I've come up with a little presentation to give to you guys before we get in to the assessment parts later. And we'll hand those out here after a bit. But for now, I want to share with all of you detailed medical and trauma assessments and how they save lives. Okay? Learning these skills will aid in your ability to get the right patient to the right hospital in the right amount of time. If you spend any time in EMS at all, you'll hear that a lot. The right patient to the right hospital in the right amount of time. And that's really, that's exactly what our ultimate goal is for every single patient. Okay? Okay. Good detailed patient assessments lead to better patient outcomes. Okay? The better you are assessing your patients in the pre-hospital setting, the better the patient is going to be later on down the road. Okay? Well, why is that? Well, because we're going to take care of injuries sooner rather than later. And if we deal with injuries sooner than later, there's a better probability that their healing time is going to be less and things of that nature. Okay, let's talk about this scenario here real briefly. Say we get an ambulance call, and the dispatcher comes on and says, "Attention Beaver County EMS, we have had a head-on collision on Highway 412 involving a semi and a minivan. You are to respond 3 miles east of Balco Public Schools. No further information is available at this time." Now I want to raise the hands in here. How many people in here would be going to something like that for the first time? Okay. Several of you? Okay. What are some of the things we need to consider when we get called out to something like that? Well, we already know that the dispatcher doesn't know how many possible patients we have. Okay? But we know that a minivan can hold up to 6, 8, sometimes 9 people. We know it's out by the school. What time of day is it? Okay. Could this minivan be full of a bunch of kids? Could be. So in this type of situation, what you want to do is you got to dig in and get some additional resources out there. Okay. You got to get a hold of Parrington, get a hold of Guymon, get a hold of Liberal, and start rolling in your direction before you ever even get out there. Okay. And vice versa. Somebody like Guymon, Liberal, if they need help with something like this, they can call us. Okay, another thing, so when you look at this, you're thinking traumatic injuries, right? Possibly maybe even a fatality, or maybe even multiple. Okay, but we need to consider what causes accidents like this. Well, is there a possibility that the semi-truck driver had a stroke and ran into the minivan and he crossed the center line? Okay.
Or the minivan.
Right. Or what if the minivan driver had type 2 diabetes? Okay. Took too much insulin this afternoon. Ran across the center line. Hit the semi. Okay. So when we get out here, not only do we have to be ready to take care of trauma, but we have to be able to handle medical as well. Okay. I've been a paramedic for 7 years, and I've been here. Okay. I've had 5 people on backboards. and one of them's having a stroke. Very tough situation. But we always get through it. You will get through it. It will be okay. It's okay to be excited. It helps you get through it. Okay, so let's talk a little bit more about medical assessments. So, what is a medical assessment? Now, let's go a head to toe, try to determine, what's causing their sickness or illness. It enables the EMT to be able to determine the underlying illness that's causing the patient to be sick, right? Now, there are a lot of things that go into medical assessment. And, we're going to go over some of those things later. But keep in mind, you guys are what? 2 months into class right now? Is that right? You don't have to know everything. Okay, you don't even have to come close to knowing everything right now. We have time to develop these skills. Okay? And as we develop these skills, your skills get better and the book gets easier. Because once you have a foundation, then it'll get easier. Okay? So to help build that foundation, I want to talk about 3 main points of just basic medical assessments. Okay, for any medical patient, or even trauma patient, right, we're going to do all these things for a trauma or medical patient. We're going to determine the patient's medical history. Okay, keep in mind that these are just 3 main points. There's more to this, but we will go over it later. Okay, determine the patient's medical history. Okay, so we go into a residence. We have an 80-year-old woman sitting in a recliner, complaining of upper and lower abdominal pain. Okay, well, we need to question her on her medical history and find out, is there anything in her medical history that would suggest, that would be causing the abdominal pain? What if we just loaded this patient up and never found out that she had a history of Crohn's disease? Okay. We bring her into the hospital. The hospital is unfamiliar with this patient. She's from Garden City. She's never been here before. She's just down here visiting family, and nobody ever treats her for her Crohn's disease. But we could have prevented that whole situation by just asking and finding out her medical history. One good way of doing this is always taking the patient's medications to the hospital with you, okay? Because there's a reason they're taking it, and we can find out some of those reasons later, but always try to take the medications to the hospital with you. Okay, obtaining vital signs. Well, for right now, vital signs, you guys, should mean blood pressure, okay, pulse oximetry, body temperature, respirations, and pulse, or heart rate. And once we find that information out, then we can start the process of elimination, okay? If she has a pulse ox at 98% and she's breathing adequately and she has clear lung sounds, we can probably rule out pneumonia on the spot, things like that. Okay? Does the patient complain of any pain? Pain is one of the most diagnostic tools we can use. Okay? We always want to ask things like, on a scale of 1 to 10, 10 being the highest, how would you rate your pain right now? With 10 being the worst pain you ever felt? Some patients will tell you 12, which is not what we're looking for. Anyway, patient's pain, does it radiate the quality of the pain? And we're going to go over some of those things here in just a little bit. Let's talk about trauma assessments for a moment. Okay, what is a trauma assessment? Okay, well, it's a head-to-toe assessment, and we're going to try to determine if the patient has life-threatening injuries. And basically, there's 4 things that we need to be concerned with, especially tonight as we move on. Okay. Okay, this especially goes for trauma patients. And once you develop this, you'll do this for every patient. But for right now, let's refer to it for trauma patients. We always want to assess the patient's level of consciousness. When we do a patient care report, we always put alert and oriented times 4, 3, 2, or 1. Okay? What that means is times 4 is person, place, and event, and time. Okay, so if a patient is alert to their person, which is to themselves, they know who they are, and they're alert to their place, they know where they're at, okay, and they're alert to the time of day it is, and then also they're alert to the event of why the ambulance was called. If they're alert to those things, they've got their faculties pretty well together, okay? Then you say, well, patient's airway. Well, if they're alert and oriented times 4, and they're talking to you, they obviously have a good airway. Now, in an unresponsive patient, and say you have gargling respirations, okay? For trauma patients, that's when we need to start exposing the body, okay? Looking at their chest, looking at their trachea, their throat, looking in their mouths, suctioning the airway, okay? Adequate circulation. Well, we can establish that by taking a blood pressure, okay? If they have a blood pressure of 40/20, their circulation isn't adequate, okay? And you guys need to get an ALS unit en route to your scene, or intercept with them. Or, if you're 2 or 3 minutes from the hospital, you need to get your patient to the hospital immediately, okay? How many of you in here have heard of capillary refill? Okay, that's a good determination of circulation. Okay, so when you press your finger on your palm and you let go, that white little circle, when it goes back to pink, how long ever that takes, is your capillary refill time. You want less than 2 seconds. If it's longer than that, there's a good chance that the circulation is compromised at some degree. Let's talk about some acronyms that help us remember some of these things. Okay, Abkürzt. When we get on the scene, say we're going to this car wreck, okay, we want to remember this acronym. If we're looking at a patient that's severely injured. Okay, onset of events as though, okay, what caused the event, what caused the injury, provocation, and what makes the pain worse, what makes the pain better. Okay, give you an example of that. So you have a patient has a left shoulder injury from this car wreck. Well, obviously, the pain is going to be worse when they move their left shoulder, right? But the pain is going to be better if you splint their shoulder properly with a sling. Quality of pain. Okay, when we talk about quality of pain, we want to talk about, is it stabbing? Is it sharp? Is it dull? Is it heavy? This is important for chest pain. Sharp chest pain is better than dull and heavy chest pain. I'll take sharp chest pain all day long. Heavy chest pain that's crushing is way more likely to be a heart attack or some kind of cardiac ischemia. Region, radiation. Okay, region basically just what region of the body is it hurting? Does it radiate? Does it radiate just in that region? Okay, when we talk about radiation, I'm sure you all have heard about people who have chest pain with the pain radiating down their arms, right? Okay. One little note here, I want to bring up. A lot of women don't present with real, real crushing chest pain symptoms of heart attack. Okay, they present with back pain and then pain in their arms. Okay, so keep that in mind. Severity, again, scale of 1 to 10, 10 being the highest. Can you rate your pain for me? Time. How long have you been having this pain? Some people will tell you, I've been having it for 4 days. And you're there at 3 o'clock in the morning. You're like, okay, well, why are we here at 3 o'clock in the morning? Okay. Decap BTLS or decap bottles. Okay, deformities and dislocations. So, what we're looking for there, is there any abnormalities like bumps that shouldn't be there? Like, do they have a bump in their, midline here in their forearm? That would, suggest like a fracture. Anytime you have something really bad traumatic, I want you guys to look at their backs real good, okay? When you log roll them over, you always want to check their backs for deformities. Dislocations, obviously, you should be able to see if a ankle or a hand is dislocated. Sometimes, pre-hospital, it's hard to determine if we're talking about a dislocation or a fracture. Either way, kind of treat those things the same. Crepitus and contusions. Crepitus is just kind of like a crackly sound, like if you push down on their chest and it crackles, or and contusions is bruising. Abrasions and avulsions. Abrasions, you'll see a lot of that kind of thing. With motorcycle wrecks and where they have real bad road rash. Penetration of punctures. Punctures like stab wounds. Penetrations, anything that, any object that pierces the skin or goes into the skin. Burns. Tenderness. Lacerations. Which are cuts. But we always want to stop bleeding, wrap it up, and swelling. And basically, as you can see, it's pretty simple. Most of those words up there, we've all heard, and they try to keep it as simple as we can. It's just a way to remember when you're doing your assessment on what you're supposed to be looking for. Okay, now when we are trying to discover all the injuries for this patient, how are we going to do that? One of the big mistakes in EMS is bringing in trauma patients who are completely clothed. Okay, trauma patient, like say we got to this wreck we were talking about earlier, those patients, you have to completely take their clothes off. Okay, I'm talking about undergarments and everything. Okay, and the first couple of times you do that, you may be somewhat uncomfortable. Okay, I know I was, but you get used to it. Because the only way to make sure that there's no injury there is by looking. I don't know how many times I've seen it in an emergency room where they have a big bulge in their back and they come in with all their clothes on and nobody knew about the injury till the patient already been through x-ray. Now with that being said, there's even been patients sent home with injuries like that weren't discovered. So the sooner they get discovered, the sooner they can be treated. And when we talk about treatment, we always want to pick the most appropriate facility, right? And so let's talk about that for a minute here. Okay. The stability of the patient. Is the condition medical or a traumatic injury? Okay. Are they alert and oriented? Do they have a good blood pressure? Is their pulse ox good? Is their pulse ox above 95%? They're not running a temperature. They're still complaining of the abdominal pain. Okay. But all their vital signs are good. We don't see any reason that they're going to die in the next day, even 2 days, a week. Okay. They're stable. Those kind of patients, no problem at all, they can come here to Beaver. Okay. Now let's talk about life-threatening emergencies. Say we're out on this car wreck and we have a patient who's not breathing very well. They have a pulse ox of 84%. They have obvious rib fractures. You can't hear lung sounds very well. And so you decide, well, this patient most likely needs a surgeon. Well, is that offered here? If we're out by Balco, do we want to bring this patient here? No, we don't. What we want to do is we want to call for an air ambulance, helicopter, airplane. Okay. If I was out by Balco, what I would do with a patient like that, have trouble breathing, have broken ribs, couldn't hear lung sounds, say their blood pressure would drop a little bit, I would go ahead and load them up and take them to Perryton. Okay. And why we were en route, I would try to get some like Lifestar or Midwest Life Team. Okay, another good one. Who's the one other guy?
Apollo.
Yeah. When you're talking about getting other help en route when you first get the call, is there, if you know you're going onto a head-on with a semi or any vehicles, is there anything wrong with going ahead and getting a helicopter en route if they're able to fly?
No.
You're going to have a long extrication on something like that most likely anyway.
Yeah, that's a really good point. What he's saying is, on the way to the call originally, we're back in that scenario where we've just been paged out to it. It's okay to go ahead and call somebody like Lifestar. My advice on that is to call a helicopter. Okay, try not to call an airplane in that situation, because a helicopter can land on the scene. An airplane cannot.
We got to bring them back.
The guys that work on the helicopter, they'll come and help you with they'll land on the road, they'll help you stabilize patients, they'll take the most critical. It's a great deal. Okay, so say Eagle Med can come, or Life Team, or not Life Team, but Woodward. Yeah. Say Woodward can bring their helicopter. That's the route you want to go for that situation. But helicopters aren't always available, right? Because of the weather. And if you're in that situation, get them somewhere like Perryton and let the airplanes know. My experience with that, with something big like that, most of the time they are ready. But that doesn't mean that they do, and you have to double check that. Okay. Don't forget, one thing that's real easy to do is to lose communication with the patient. Okay. If they're not unresponsive and they're alert, it's easy to see the patient just as injuries or illness. Okay. Let them in on the decision making. Okay. If they have a specialist in Amarillo that normally treats their condition, then it's probably best to find some way to get them to Amarillo.
A lot of older patients already have cardiologists, so they have.
That's right.
They have everybody. Yeah, I need to go to Wichita. I need to go to Oklahoma City.
So like basically, say that 80-year-old lady I was talking about earlier. Say if we find out that her underlying problem is a cardiac issue, she can have some abdominal pain and cardiac issues. Well, say she has a doctor at Oklahoma Heart Hospital. Well, she's not going to want to go to Amarillo. So it's important to keep the patient in the loop on things like that. Now, sometimes that doesn't always work out because of Oklahoma Heart is too busy and they can't take her. That could happen. Okay, now to conclude, good medical and trauma assessments, okay, they absolutely save lives, okay? And it's all about getting the right patient to the right hospital in the right amount of time. Okay, that's what we're trying to do. That is our ultimate goal. You can be the difference for these patients, and you will be the difference for these patients. What you do not only can, but will determine if someone lives or dies. How well you perform under these pressures and how well you train. The time is approaching you, and the moment you realize that the patient's life is in your hands, you have to react. Now, one last thing on all this. All of you in here, okay, I've been where you're at. And some of you probably haven't even ran an ambulance call yet. And if that's because of fear, I understand. Okay? But just know that it's going to be okay. And whatever it is, whatever the situation is, you don't go alone. We're all in there together. Okay, and we all have each other's back.